Good afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely. It may be due to chemicals in certain food, allergy in certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, venereology, and leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incident is higher in older age group. Urticaria is classified as acute and chronic, but most important part is not to ignore it, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria, its types, how we can prevent it, and the kind of test required for a diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Sarmistha Basak. She's a renowned dermatologist, cosmetologist from Kolkata, and practicing in Sarmistha Skin Clinic, Kolkata. She completed her MBBS from Calcutta University in the year 2005, Post Graduation Diploma in Health Sciences and Medical Cosmetology from Annamalai University in 2008, and holds Masters in Practical Dermatology from Cardiff University, United Kingdom in 2019. She also completed her fellowship in aesthetic dermatology in the year 2020. A warm welcome to Dr. Sarmistha Basak. It's a pleasure, doctor, to have you here with us today. And we are going to discuss on a very important topic, which is the management of urticaria. And the first question we have for you is, what is urticaria?
Thank you, Priyanjali, for a nice intro. Sorry. And hello, everyone. So, Articaria, commonly we call it hives, or in Hindi we call it pitti. In Bengali we call it ambat. So, I think 20% of the population, 15 to 20% of the population suffer from this disease in their this disease. So, what is it? It is by definition, if we go by definition, it is characterized by wheals and angioedema. So, what is a wheal? Wheals are raised erythematous, raised red patches on skin, which are mild to moderate to extremely itchy, which can be due to which can be inducible or not inducible. The lesions are usually transient, and the duration of each lesion may range from 24 to 78 hours even. These are wheals. Another thing, when the edema or when the rash or when the fluid is inside, involves more deeper tissues or subcutaneous tissues of our body, we call it angioedema. So you can see that our after eating something, or after a trigger like cold, like pollens, like taking prawn or something, you can see that your lips have become swollen, you can hardly breathe. This thing is called angioedema. So to summarize, urticaria is characterized by wheals and angioedema.
Right, right. Well, by now we know what is urticaria, doctor, after this very beautiful explanation. But what does the initial stage look like? Normally, what happens is identifying the cause, the disease, the condition becomes very difficult for anybody. So, how does one person know in the initial stage that this is urticaria? How do they identify it?
See, urticaria, the only urticaria are actually red rashes which are elevated from the surface, from the skin surface.
Hmm.
They may be small, they may be big, but the skin temperature is usually raised on those patches. And the most important thing is the patches go without leaving any mark. without
Okay.
leaving any mark. Maybe the rashes may stay for 1 hour, the rashes may stay for maximum 72 hours also, but usually there is no mark left. That is very
Hmm.
characteristic of urticaria. Usually, when there are hives or wheals, they are very itchy. Itching maybe so that patient can't sleep even. So this
Hmm.
is one thing. And another thing is, when the urticaria, the disease involves our deeper tissue, we call it angioedema.
Right. Right. We know that it can be a slightly, above from your skin surface, as you mentioned, doctor. Also, it can be itchy. So also you mentioned that the mark, that the sign, that the thing can stay for 1 hour, also it can last to 72 hours. For the people who saw that thing occurring or appearing on the skin and after 1 hour disappearing, so is that a reason to worry? What do they need to do immediately after they see that change? And then there are also a lot of people who takes such thing lightly. उनको लगता है कि शायद कुछ लग गया होगा, कोई इंसेक्ट लग गया होगा, तो मे बी थोड़ी देर बाद फिर से ठीक हो जाएगा, व्हाट नॉर्मल पीपल डज, बट व्हाट शुड दे एक्चुअली डू, एंड इज दैट अ थिंग टू वरी?
See, urticaria, as you have just said, that we all must have faced urticaria at some point of time in our lifetime.
Right,
So,
right.
most of the time it is not that worrisome. But when it involves our deeper tissues, means if urticaria involves our mouth, our eyes, our internal organs like larynx, pharynx, so we can choke, we can hardly
Hmm,
breathe, and that can even lead to death. So whenever
hmm,
you feel that you are choking, you can hardly breathe, rush to the hospital. That is my standing advice to any of my urticaria patient. Don't wait for me, don't wait for anybody, you have to rush
hmm.
to the hospital. And there are certain medications they have to take, keep in handy, like EpiPen, epinephrine injection. There's some urticaria patients who are known to have urticaria. These medicines are usually kept by them. They can inject them those medications. There are, in a percentage of case, there is a condition called anaphylactic shock, which is a very life-threatening condition where patient
Hmm.
can actually collapse, patient can actually die. So these are the severe conditions of urticaria. This can happen to
Right,
anybody anytime, but it is not that common.
right, right. Doctor, mentioning anybody and anytime. So the people who has a tendency of having urticaria from food, specifically, we are talking about food here. So, what if is it possible that since childhood they are having it, or it can occur at any time in their life? So for
So
the people, suppose somebody is having prawns, as you have already mentioned, the person is having prawns since childhood, and then all of a sudden, someday he sees that there are some, effects of prawns which can see in his or her skin. So can it occur at any point of time in their life, or the condition is always there since childhood?
see, now coming to the types of urticaria, there are
Hmm.
actually two types of urticaria. One is
Hmm.
acute and one is chronic. So
Hmm.
when the episodes of urticaria lasts for less than 6 weeks, so this is called acute urticaria. And when the
Hmm.
episodes last longer, people are developing urticaria throughout our life. When whatever may be the cause, we call it chronic urticaria. But these are types of spontaneous urticaria. In spontaneous urticaria, that usually there is no cause detected. But what you are just saying, that the patient who is allergic to prawn, usually they will remain allergic to prawn lifelong. So whenever I come across a patient who is allergic to prawn and takes a prawn later in their life, it is actually trying to commit suicide. You shouldn't take. You shouldn't take.
Hmm. Hmm. Right, right. So, for the people who have a tendency of having urticaria from food, what is the first thing? What is the preventive measure for that person, doctor? What should the person do initially? Because they are not able to understand किस वजह से ये change आ रहा है? Why is this thing happening again and again?
See, there are not many foods which a person is allergic to. Most common
Mm,
which I have come across is shellfish, like prawn, crabs, etc. Some in children, sometimes cow milk can lead to urticaria, and sometimes
mm,
nuts, peanuts, preservative colored food items, brinjal is very common, tomato. These are the
mm,
usual things. Sometimes beef. Hmm. So when
mm,
we get an allergy profile done, we find these things. People who are highly allergic, whose IG level against this, we get a test done. IG, we get an
mm,
we advise for an allergy profile test, and we find
mm,
out specific immunoglobulin E level against these food items. When we find
mm,
out the person, those person to be allergic to those certain things, we ask them to avoid it. Avoidance is the best, because if we can avoid it, then the episodes can be avoided completely.
Right, right, right. So again, identifying the food which is causing you trouble is very much important. And for that, please, we always say our patients, all the viewers who watch us, who follow us regularly, that please do not go for self medication. Always take an expert advice. प्लीज अपने आसपास मौजूद लोगों की बातें ना सुने, और एक्सपर्ट की सलाह हमेशा ले. Whenever you see any change in your body, the first person you should contact is the expert. Moving ahead, doctor, to the next question. Uh, is urticaria a serious disease?
Urticaria is a common disease, just like I said, but it can be serious sometimes. It can be serious, it can be life threatening sometimes, but the percentage is very small. When
Mm,
anaphylaxis happen, when the person goes into shock, and that is the blood pressure falls, patient chokes, patient can it can lead to death sometimes. So urticaria can be very serious. There are some certain other subtypes of urticaria, when the deeper varieties of urticaria, like arterial vasculitis, where urticaria involves the blood vessels. Those patients needs long-term therapy with serious medications, with immunomodulator medications. So in that way, it is serious. And people with chronic spontaneous urticaria, where no cause can be detected, and those people can suffer for years, maybe 10 years, 15 years. They have to go on taking medicines for years, 10, 15 years and whatnot. So in that way, their lifestyle is somehow changed. They are not having
mm,
normal life. So that way you can say urticaria is serious. But
right.
I would like to tell about other varieties of urticaria. In one variety of urticaria, like inducible urticaria, where there is an aquagenic urticaria. So patient tends to get rashes when they come in contact with water. So
Mm,
you can imagine how severe it can be.
right,
So patient,
right.
when they are swimming, they can get an arterial attack and they can drown,
Mm,
and they can
mm,
that can lead to death. So
right.
that severe, that serious can it be? So urticaria, yes, urticaria can be a serious condition.
So, doctor, the kind of urticaria which you have just mentioned, it definitely is very scary. So, is this condition since childhood, or again the same question? It can occur at any point of time in your life.
See, one variety, one classification of urticaria, I just said that acute and
Hmm.
chronic. Other is amongst there are two types of urticaria, spontaneous urticaria and inducible urticaria. Spontaneous urticaria or idiopathic urticaria, where we can't find out any cause.
Right.
There is no cause. And inducible, the cause
Mm-hmm.
earlier it was, we used to call it physical urticaria. Some there are cause known for this urticaria.
Mm,
Sometimes what I have seen in my practice, that sometimes people in slightly older age group, they have developed this kind of urticaria, not from since childhood, but some have developed this kind since childhood even. So
mm-hmm.
these, in this inducible variety, there are like delayed pressure urticaria. So people wearing
Mm,
tight clothes, whenever they open the petticoat, or whenever they open the belt, tight belt, or open the
mm-hmm.
pant, they are severely scratchy. This is a form
Right.
of delayed pressure urticaria. Another thing
Right.
is solar urticaria. This is a very serious thing. I have seen a tennis player, whenever they go to play tennis out, he or she can't use adequate amount of sunscreen all day, na? But she
Right.
developed articarial rashes all over her exposed part. Even she
Mm,
covers her whole body. She can't cover her this thing, no? This palm, her
mm,
dorsum of the hand. She develops rashes
right.
there, and she faints.
Mm,
So this
mm-hmm.
is solar urticaria, very rare, but I have seen cases. Now,
Right.
aquagenic, I just mentioned. Cold urticaria, there's people develop urticarial rashes if they touch this thing, touch eyes, or if I have seen, I was performing one surgery, and after surgery, I was using this thing, eyes on the area where I had done the procedure, and the area just became swollen and red. Then the patient told me that she usually gets that. She has that thing, that she is allergic to ice.
Mm,
So this kind of thing happens. This is another form. Another is vibratory urticaria. Vibration can lead to urticaria. So cholinergic urticaria, emotion,
mm,
physical exertion can lead to urticaria. And these are all forms of inducible urticaria. So another is spontaneous, where no cause can be detected, and this is inducible urticaria, where cause can be detected.
right. Right. So, doctor, a very important question, which everybody would be thinking right now, all the people who are watching us, are these conditions contagious? Can it
No,
spread through
no,
touch? Is it
no, no,
possible?
no, no. Urticaria is only limited to you. It is not at all contagious. Not at all.
Right. Right. Doctor, what is the role of hygiene in urticaria?
Hygiene directly per se has no role, but
Mm,
urticaria, acute urticaria, is sometimes related to this thing, some infections. If you are having some infections in your body, like chronic fungal infection, like certain viral infections and streptococcal infections, um,
mm,
gastritis, that they can lead to urticarial rashes, UTI. They can lead to urticarial rashes in certain patients. So patients who are
mm,
suffering from long-term fungal infection, their hygiene is compromised. So if you are taking
mm,
care of your hygiene, you will avoid actually two kinds of diseases. You will avoid your infectious disease, as well as the urticaria, which is triggered by that infectious disease.
right, right. So again, for all the people who are watching us who are taking fungal infection lightly, especially as we know this is the fungal infection month, and
Yes.
people normally they tend to have fungal infection during this period. It's monsoon now, rainy everywhere, things are wet. Please do not avoid such things. Also, people who are continuously suffering from UTI. Doctor has already mentioned that this is a thing to worry, and any sort of disease we always suggest please do not prolong it. Try and visit the expert in the initial stage. Speaking of that, doctor, what are the treatments available currently for urticaria, for acute and chronic both?
See, for acute urticaria, if the urticaria first line treatment is antihistaminic, there are various antihistaminics available, so we can go up to 4 times the recommended dose. So, sedative
Mm,
and non-sedative, I prefer non-sedative antihistaminics. Though levocetirizine is preferred by many, but I prefer Bilastine.
mm,
I prefer a combination of Bilastine and levocetirizine that works well for me. Morning I give
mm,
usually Bilastine, and at night I usually give levocetirizine. In certain patients, I usually give 4 times the recommended dose. I get good results. Sometimes we have to combine. These are H1 blocker, histamine receptor H1 histamine receptor blocker. Sometimes I also combine H2 histamine receptor blocker, because in some studies they have said we have to use two types of H1 and H histamine receptor blockers for this. So I use ranitidine for that
mm,
purpose. In certain patients who are having it very severe and acute, I'll give a short course of oral steroid, maybe for 4 5 days, and then it's usually a cure for acute urticaria. Sometimes I add Montelukast and certain topical soothing agents containing lactocalamine, and other capsaicin, and so many pramoxine, so many things. So the mm, uh, area is calm. So these are
mm,
for my acute management of urticaria, management of
mm.
acute urticaria.
Right. And what about chronic, doctor? What are the treatments available for chronic?
Chronic urticaria, when the patient comes with urticaria where the duration has passed for more than 6 weeks, it is usually chronic urticaria. In chronic urticaria, I sometimes ask the patient to go for certain tests, like whether there is any thyroid disorder, whether there is associated vitamin D deficiency, whether any
Mm,
viral illness associated with it. I ask for certain other tests like Ig level, immunoglobulin E level. I sometimes ask for allergy profile, ANA. There are whole lots of tests. I ask for urine, RE, look for fungal infections, etc., etc. And then I give anti-allergics first line anti-allergics, but I don't prefer giving, usually don't give oral steroids for chronic infection. In that case, I usually prefer giving, if not better, by anti-allergics, and if no cause, if the patient is absolutely fine, all blood reports are normal. Usually, I find
mm,
vitamin D deficiency in almost every chronic urticaria cases. If I
mm,
don't find that, and if iron, there is no iron deficiency, if there is no sign of in chronic urticaria, also sometimes what I find is patients suffering from amoebiasis, patients suffering from this thing, intestinal worms. Even deworming helps. I even after I have done all those things and patient is still not better, then I consider other immunomodulators like cyclosporin, dapsone, etc. In other variety of chronic urticaria, and also acute urticaria, when the a single lesion is persisting for more than 24 hours, I ask the
mm,
patient to go for skin biopsy. I perform a skin
mm,
biopsy, or I go for skin histopathology to find out whether this is actually only urticaria or the lesion are deeper, means whether it is an urticarial vasculitis. If this is
mm.
urticarial vasculitis, then I give long-term steroids, colchicine, whichever is required, or dapsone, whichever is required for this patient.
Right, right. Well, now we know about the treatment options, and we know the patients are normally scared to visit the doctor just for the treatment. And in such case, they visit the chemist. The chemist gives them some steroidal drugs, maybe some ointment to apply. So, how harmful can self-medication be in this scenario, according to you, doctor?
Because the chemist doesn't know what the disease is, so they give what not. Because nowadays
Mm,
chemists usually think that this is fungus. Whatever
Hmm.
comes to them, any skin
Hmm.
disease, chemists usually think that this is fungus. So, one dose of
Hmm.
itraconazole patient will be taking. One dose of anti-allergic they may give or may not give, but itraconazole and luliconazole patient will be giving to the patient will be taking. So that is a
Hmm.
problem. We don't know. I have come across with patients who have developed itraconazole induced allergy. So, which is the actual allergen? Itraconazole or the urticaria? We don't know because itraconazole has a
Hmm.
rash potential also. Every patient who come to us, they have taken or self-medicated with itraconazole and luliconazole
So
by
we get
given
to
by
see
the
this on a daily basis. The self medication thing is happening actually.
actually. Earlier, it used to be triple drug combination. Now it
Hmm.
has shifted to itraconazole and luliconazole.
Right, right. So, everybody, all the viewers who are watching us right now, people who are suffering from urticaria, this is a honest request to everybody that please, please do not go for self-medication. Your body is different. It's different from the others. Also, a chemist is not the person you should go to whenever you're facing any issue with your health. Why do you put your health at risk in any scenario? Why would you like to do that? Um, Plus, we know people, they try to save money. They think कि डॉक्टर के पास जाएंगे, इतना सारा दवाई लिखेंगे डॉक्टर, they'll give us so much test, and then ultimately it's a wastage of money. But you all are anyhow wasting more than that. You anyway have to visit the doctor after the medications you're taking from the chemist. So why not visit the doctor previously or earlier, so that you can actually save some money if you're thinking about money. Moving ahead, doctor, we know that any sort of disease or condition looks a different in patients with diabetes or thyroid. So how does urticaria look in diabetic patients or patients suffering from thyroid?
Diabetes has not much role in urticaria,
Mhm.
but in
Hmm.
management because whenever a diabetic patient comes with urticaria, we start to think what to give. If the urticaria is severe, we can't give oral steroid. If the urticaria is severe, we can't give cyclosporine because that will there will be difficulty in managing diabetic status. Their diabetes will be their sugar level will go up. So that
Hmm.
way it is a problem. Otherwise there is nothing much diabetes has to do with urticaria. Apart from that, their body diabetics have a very dry body, so itching will be more. So you have to I always say to all my diabetic patients that moisturize, moisturize and moisturize. So always moisturize your body, keep your body calm with moisturizers and good quality moisturizers, and use sulfate free colloidal oatmeal based cleansers that will not make your skin dry. So that is my prescription for all diabetic patients. Another thing is uh, in diabetics, usually their renal function is also very compromised. Sometimes what I see that I can't give all medicines. Just I said I can't give steroid, I can't give cyclosporine in them. Sometimes I also can't. Sometimes can't give other anti-allergics. So in that these patients, belastin come as a very good choice because they are. They don't need dose adjustment in renal and hepatic impairment. So that way diabetics have are of special consideration. But and you said thyroid has a role. Hyperthyroid, hypothyroid, and this patients with thyroiditis, they can develop urticaria, so they have direct connection. So we always check whether when a patient coming with urticaria, we always check their thyroid status.
Right, right. So patients with thyroid, this is a thing to worry. You need to be cautious, especially with the food you are eating, especially any changes in your body you see initially. The first thing, you know what to do by now. Moving ahead, doctor, with the next question. you mentioned moisturizer initially. So, what if somebody is suffering from urticaria on the face, on the facial area? Do we suggest them to go with the regular skincare regime? Is that safe? Also, nowadays there are a lot of peptides, retinol, and a lot of creams available in market which people use intensively. So, will those be safe to include in their skincare regime? If not, what is the basic skincare regime they can follow?
Because we have seen also cosmetic induced urticarias like
Mm,
hair dye induced urticaria is very common. Parabens,
mm,
ppds, they are present in the cosmetics. They are very common agents which lead to contact urticaria. And also
mm,
there is another form of contact urticaria, this rubber gloves which can lead to contact urticaria. There are certain cosmetics which use this oil of bergamot, or which use this flavored substances. They can lead to increase your itching. They can lead to urticarial rashes. They can stimulate urticaria. So whenever an urticarial patient having severe urticaria comes to me, of my prescription changes. I prescribe a mild cleanser, mild moisturizer with sulfate, where there is no sulfate, no paraben, and only cetyl alcohol based moisturizer, only cleanser, only ceramide based skincare products. I just moisturizer, I give just that, nothing else. And when while while choosing a sunscreen, I don't prescribe even chemical sunscreen. I prescribe only this physical sunscreen when I
mm,
when I come across a urticaria patient. And also I advise not to use any hair dye, not even mehendi, because this is a very common question I come across,
mm,
whether I can't use mehendi, because you all know, na, mehendi also contains, commercial mehendi also contains this pigments, these dyes. So I also
mm,
advise against it. So these are my this thing. And also no active ingredients until means retinol, what not they are using nowadays. I also advise against it until they are a little better. Then I pick and choose whatever necessary. I only give that.
Right. Well, this is a very important thing, Doctor, which you have just mentioned, Mehendi. We have never talked about this topic, maybe, but we see a lot of people using henna. So we today have come to know that henna also can be harmful. We know people, uh, they see a lot of discoloration from hair dyes. Also, there are skin irritation from hair dyes. People generally they stop using hair dyes, but then they start accepting henna. So henna also can be harmful, and for the people who are watching us, this can be really helpful for you. Moving ahead, doctor, tell us about over-the-counter medications. Can it also trigger urticaria? Also, women who use oral contraceptive pills on a regular basis, can it also trigger urticaria?
Yes, yes. Penicillin is a very commonly used medicine, antibiotic. You must have heard. I have taken. I have a funsi which has come up. I have taken
Hmm.
2 doses of amoxicillin and it has gone. But even after 14 days, you can develop urticaria if you are allergic to it.
Mhm.
So
Hmm.
it is that severe. So penicillin, cephalosporin, the fluoroquinolones, any antibiotic, even paracetamol, even NSAID, painkillers, which we tend to take any time, just like a lozenge we take, right? So they are
Hmm.
aspirin. Aspirin is a life-saving medicine, ecosprin. They can give rise to urticaria with a different mechanism, but they can give rise to
Hmm.
urticaria. So you have to be always, because even your doctor doesn't know, but you have to be always careful that what medicine are you taking, and you have to always take medicine as per your doctor's advice. Then at least your doctor will know what you are taking. Sometimes what funny things happen now, even very educated person comes to me and say that I have taken that yellow medicine with this pink border. then I'm at a loss. He or she is also at a loss. I don't know how many yellow medicines they have taken and what yellow medicine. So this should not be the case. If you have taken that yellow medicine, you have to be responsible. At least know the name so that even it
Yes.
is Hebrew to me, I can search and find out what is the content.
Right, right, right. People nowadays, we use technology. We see kids using smartphones nowadays, but why aren't we using the smartphone in the correct way? You get every possible information in Google and Wikipedia. You can just just Google the combination of your drug or the medicine which you are having. It says everything, all the side effects, all the do's and don'ts. You get it all in Google. So why not use it wisely? Please, please, be careful with your health. Never put your health at risk, because we always know that health is wealth. So अगर अगर wealth जिंदगी में चाहिए तो हेल्थ का ध्यान तो रखना पड़ेगा. Today we are in discussion with Dr. Sharmishtha on the topic of urticaria, and we'll quickly move on to the next question, doctor. Then uh, tell us about the dietary precautions, the do's and don'ts for the patients of urticaria.
See, for patients with urticaria, um, patients who have inducible urticaria, who know that I am developing urticaria because I am allergic to prawn, I am allergic to kali mehendi, I am allergic to this thing, so I am allergic to NSAID, means painkiller. You mustn't take those things. This is
Mm,
primary thing. When people who doesn't know that you are allergic to what or chronic spontaneous urticaria patient or acute spontaneous urticaria patient, never miss your urticaria medicine. Always carry those medicine with you. And another thing I would like to say, urticaria can sometimes be life threatening. So whenever you feel a choking sensation, please don't delay. Go to a hospital which has an ICU facility so that they can intubate you, they can ventilate you, they can nebulize you so that your airway can be maintained. And always check that whether the person is breathing has to be ensured first. And if a bee has
mm,
stung, remove the bee. If you have accidentally ingested a medicine, always remember the medicine name of the medicine which you have taken. These things are preliminary things which you have to know and
right,
you have to follow.
right. Doctor, can COVID also cause hives on the face? Is it possible?
Yes, yes, yes. During the COVID era, we had come across a lot of urticaria cases,
Mm,
So now
mm,
urticaria has gone down, means this thing normal is normal rate, but during the COVID infection itself, as I told, like
mm,
any viral infection can lead to urticaria. COVID also had its share.
right,
So post COVID, we had a lot of urticaria cases, lot of urticarial vasculitis cases. Even post COVID vaccination also, I had seen a few, not that much, few urticaria cases. So COVID has had its share of urticaria cases.
right, right. Doctor, what about stress? We have this question in our head. We always do, because stress can indicate a lot of conditions. Also, it is very tough to, identify that it has been caused from stress. So, does stress also has a role to play in urticaria?
Yes, stress is a very important thing, which is one of the most under discussed thing and most under
Mm,
diagnosed, and which patient doesn't want to recognize and doesn't want to do anything about it, because there is
mm,
no shame diagnosing that you are stressed or you are having depression, and you have to seek help, go to a psychiatrist. There is no shame. It is just like any other disease, just like getting
absolutely.
urticaria. Stress is also a thing, because when you are stressed, you are irritated, you itch more, you scratch more, and
Mm,
the hives are more. That is one thing. And
mm,
during stress, the histamine, the mast cell, they degranulate more, so more rashes
mm,
are coming. So that is a vicious cycle. So if you calm yourself with medication, from proper medication prescribed by a psychiatrist, then your
Hmm.
urticaria score will also go down.
Right, right. Again, for all the people who are watching us, we are talking about a serious issue today, and please never be ashamed to come up with your problems in front of anyone. Uh, we know we are these are medical terms, but there are also a lot of internal things happening in our body. So whatever changes you feel in your body, the first thing you should do is go in front of someone and tell the person whatever is happening, and make sure you are visiting the right person. Please don't be ashamed of anything, as doctor has already mentioned. Doctor, why does hives get worse at night? This is a little correlated to the first question, to the previous question which we have just asked you. So why does it happen? Why does it get worse at night?
See, it is a very this thing. Sometimes it may get worse at night. There is a certain sundowning phenomenon. Sometimes you get stressed at night. That's why it may get worse at night. Sometimes the hives which are related to your um, insect bite allergy. So when you
Mhm.
go to sleep, and which are related to the dusty environment, you know that our bed, our this thing has a lot of house dust mites which we are not aware of. That may be
Mm,
another reason. So there are so many reasons, and when we lie down, so many things come into our head, and
right.
we become irritated with scratch. So there are
Mm,
so many explanations can be there, but I don't believe that all it is always and everybody get hives more at night. But
mm,
what happens is the type of hive is so severe in some person. When they are calm, when they are not doing any work, all whatever they are thinking, they are concentrating on eating. So they can't
mm,
sleep, they can't focus on anything.
right,
But when they are
right.
doing certain works, their work is helping them to focus on other things, and that way they are forgetting eating. So that way
Right.
hives are not exactly worsening at night, but the symptoms maybe are
Mhm.
perceived, our perception is more at night actually.
Right, right. We get you totally. Doctor, is this the reason why urticarial patients are normally seen to be tired? Because they are not sleeping during the night.
Yes,
They are
absolutely,
busy.
absolutely. A good night's sleep is very necessary. So when we score an articarial patient, we find out whether he or she is sleeping good at night. So that's why we choose our anti-allergics so much, so that the patient gets a good night's sleep also.
Hmm. Right, right. Well, with that, I can see few of the questions coming from our viewers today. The first question is asked by Pooja Sharma, who asks, "How can I sleep comfortably with hives?"
By taking medications. By taking medications and getting a proper treatment and finding out the cause, what is ailing you and why the hives are coming, and then only and get a full treatment. Whether it is acute, then acute can be cured, and if it is not, if it is chronic, then go to a dermatologist. He or she can help you.
Right, right. With that, we have our next question coming from Akansha Puri, who asks, "Is urticaria a life-threatening? क्या ये क्या छूने से फैलता है? Is it contagious?"
I think we have discussed these things, but I'll just answer it in one liner that no,
Yes.
urticaria is not contagious, and neither it is hereditary in most of the cases, apart from hereditary angioneuritic edema, and but it can be life-threatening in certain percent of cases where it anaphylactic shock develops, where patient chokes and can lead to which can lead to death.
Right, right. Doctor, the initial question which came from Pooja, a little similar to the question. We see a lot of patients who who identifies the disease, who visits a doctor, who also starts taking the medication, and who leaves the treatment in between because maybe they see that the skin has been cured or the condition has been cured. So, what about them? Can urticaria reoccur again?
Urticaria can sometimes be recurrent. Yes, urticaria
Hmm,
and sometimes what I told now, urticaria is acute, urticaria is chronic. Sometimes urticaria
hmm,
can be recurrent also. Whenever it is recurrent, there is no as such that if you are better, if you have, if your doctor says that you can stop medicine, you stop medicine. ऐसे नहीं है जैसे lifelong continue करनी है. You will stop
hmm,
medicine at one point of time, but it can
hmm.
patient who have I have seen patients who have high immunoglobulin E level, they may get arterial rashes again in their life. So when that condition happens, you have to again start treatment.
Right, right. Well, again, the self-medication things come here. Whenever it's the right time, the doctor will tell you, please do not become yourself a doctor. Make sure that the work is done by the person who should do it. So आप अपना काम कीजिए जो कि है डॉक्टर की सलाह लेना और समय पे अपना दवाई लेना और medications लेना. And the doctor will do her work, and if that continues, definitely there is a cure. Doctor, again coming back to the point, can urticaria be completely cured? Is it possible? I think the answer will give a sign of relief to all our viewers who are watching us right now.
Urticaria is usually a curable condition. I think the question is slightly not properly framed. Urticaria
Hmm.
is a condition which is usually curable, but you can get recurrent episodes. So,
Right.
see, it's like fever. If you get fever, na, you can get cured. But sometimes fever happens. Sometimes, na, there are certain
Right.
fevers which
Right.
are acute. 3 दिन में ठीक हो जाता है. कुछ है टाइफाइड जैसा 3 हफ्ता लगता है. वैसे ही है.
Hmm. 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 Right. So again, the medication and being cautious about the thing which is causing you urticaria. You have to stay away from it for your
Huh,
entire life.
I
So
I'll just add one thing, but what I
yes, please.
mean is, if you are allergic, if you are allergic to prawn, you
Hmm.
should not take prawn lifelong.
Right.
That part, then only you will not develop urticaria again. But food allergy, माने thankfully food urticaria जितना बड़ा disease है, food is a small part of it only. सबको फूड एलर्जी के लिए
Hmm.
अर्टिकेरिया नहीं होता. सो
नहीं होता है, राइट।
सो बहुत कम पेशेंट को फूड के लिए एलर्जी होती है, वेरी फ्यू. सो मोस्ट ऑफ
हुँ,
द टाइम सम it is spontaneous urticaria only. So urticaria can be cured. So don't worry about it.
right, right. With that, that was the expert advice for today, and that was Dr. Sharmistha Basak for us. Thank you so much, doctor, for your valuable time. It has been a very informative session for our viewers today, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, they know now what to do instead of self-medication. It's always better to approach a nearby dermatologist. It was great to hear from you, doctor, and we look forward to many more such session in coming time. Also, thank you, viewers, for your excellent participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you.